Welcome, pharmacists, to this quick review of the 2024 BCPS exam. I'm Eric Christianson, a pharmacist from meded101.com. I have successfully passed the BCPS exam twice, one on initial certification and one on recertification, and have followed this exam, in all honesty, since about 2012, 2013. So it's been 10 plus years now of paying attention to this and obviously helping people pass this exam. So there are some changes in 2024 that are significant, and I would say more significant than in previous years. And I think the first thing you want to think about is, do I want to take the exam in the spring? If you're listening to this later, obviously it might be too late to take it in the spring, or do you want to take it in the fall? And I'll kind of outline some of the differences and what I think about that situation too. So first off, digging into that a little bit. So the spring exam, the content outline is going to be similar to 2023. So there's no major change in spring 2024. However, that has changed in the fall of 2024. At the end of the presentation, I'll go into that a little bit further about the fall exam specifically. My opinion on this is I would probably rather go into it where people have taken it under the previous content outline before, than essentially risking taking something brand new. Now, with that said, the pass rates aren't great either. On the previous content outline, but it's really an unknown of what the fall exam is going to look like, and I'd rather take the exam as a known rather than an unknown. With that said, I also want to remind you that it's not catastrophic generally for most people if they fail the BCPS exam the first time. It's generally not like the NAPLEX where your job depends on it and you getting paid obviously a pharmacist's salary. And so, if you're kind of on the fence, my advice has typically been just do it. Try to prepare the best you can and be okay with not doing that well. Obviously, you want to try to prepare, and you don't want to have to do it twice. But my sense is to just go at it and go for it, because a lot of people, I think, get paralyzed with fear a little bit. I got this going on, and I got that going on, and life is busy, and so on and so forth. And there's always an excuse. There's always something that can get in the way of doing it. So my sense is if you have an inclination to take it, go ahead and get it done. And so I would generally recommend, if you've got at least probably 2 to 3 months, I would like 3 months or more ideally. But if you've got some time to prepare and get ready for the spring exam, that is the one that I would be looking at planning on taking as my top preference. All right, we've got some info on pass rates. This is always a question I get asked every year. They do post these, so these are from early in 2023, the spring exam. And you can see the pharmacotherapy exam ranging from 62 to 70% for first-time candidates. And, this is right on par with historically where it's been. It's usually been in the 60 to 70% passing range. It is a very difficult exam because it is a very broad exam. So that definitely presents a challenge with the BCPS exam. Also, we have seen it in previous years dip below a 60% pass rate, so it definitely can vary a little bit. It's based upon a graded score, is what they term it on the BPS website. How that all plays out, is really, really challenging to know. With our study materials, I say target 80%. I think that's been a good anecdote from customers that I have interacted with through emails and things, asking them how they felt about the practice questions and then did they actually pass the exam? So haven't got any full statistics on that, unfortunately, because it's difficult to get people to respond. But I would say, in our practice questions, practice exams, if you're in the neighborhood of 80% or higher, I'd feel pretty comfortable that you've got a handle on the content. Not a guarantee, obviously, that you'll pass the exam, but that's kind of been the ballpark over the years that I've heard folks report to me. Okay, so about the 2024 exam. So there is a change in the number of questions. So if you find yourself with a little more ADHD tendencies and you wanted a shorter exam, you got it. It used to actually be 200 questions, and then it dropped to 175, and now we're actually down to 150 questions. And it's super, super important to recognize that 25 of those 150 questions are not scored. Okay? So don't lose your mind if you go into that exam and you have no idea what the answers are to the first 2, 3, 4 questions. You cannot get frazzled. They very well might be basically practice questions or test questions to see if BPS wants to put it in future exams. So you've got to keep a cool head when it comes to not knowing the answers to questions. It is certainly possible that the majority of the new questions, unscored questions, may be difficult, and so you've got to stay patient with the exam, and do not get frazzled if you have no clue what the answer is. On your first few questions or that type of thing, because I've definitely heard that reported by folks. It is multiple choice. It's one answer with 4 possible choices, so it's pretty straightforward and pretty standard as far as the tests go there. Focus on generic names. Don't spend a ton of time learning branded generic. If you've been out in practice for a while, which obviously all of you have if you're taking the BCPS exam, you're probably going to know any brand names, and they don't ask you brand names. So don't get too frazzled about obscure brand names, because they're going to test you on the generic names. 3 hours and 45 minutes. So that time has shrunk with the number of questions shrinking as well. It has been pretty standard over the last 10 years, to my knowledge, that seconds per question is pretty set at 90 seconds. So my encouragement is you've got to do some practice questions. Practice exam can definitely help to make sure that you're meeting that mark, because if you don't answer questions, you're going to get punished with wrong answers. So my encouragement is probably about a minute a question. So that leaves you with some additional time if there's things you want to go back and review. So I say target 60 seconds per question, and I think if you do that, I think you're going to finish comfortably and have plenty of time to review and think about anything else that you want to. Content outline for the spring, just a quick summary here. Go take a peek at it. I definitely encourage you to do that. We designed our study materials to follow that content outline. I went through it line by line, making sure that we had everything covered within our all-access study package. But I think it's important for you to go through that as well, just to kind of give you a sense of, what are they going to be looking for here. So the content outline domains for the spring exam only is pharmacotherapy. So that's drug selection, that type of thing. Application of evidence to practice and education, healthcare systems, and population health. So, some statistics, some regulatory things that are definitely going to be within that. And obviously the content outline itself differentiates that further there. So I wanted to, say a few things about, the different sections. So the pharmacotherapy section is 65% of the exam. That's approximately 98 of the 150 questions. My encouragement to people is study weaknesses. So if you are in practice and you're dealing with diabetes patients every day and you know the guidelines in and out, I'm not going to spend probably more than, a half hour to an hour studying diabetes. I would review it, make sure you're up to speed, make sure you know what's going on. But you're going to know that from your practice. So versus if you don't deal with any HIV patients ever, or it's very, very seldom in your practice, that's definitely an area where I would focus more and make sure you recognize the drugs of choice and important drug interactions and things of that nature. So focus on your weaknesses is a very, very important point that I think will help you kind of strategize your study preparations and make sure you don't spend a large amount of time on something that you already know pretty well. With pharmacotherapy and some of the questions, there's really two simple concepts that I like to come back to and like to tell candidates to focus on. So why you would select a medication and why you wouldn't. And I go through that a little bit in the next slide here. So looking at those case scenarios, that drug selection, why you would and why you wouldn't select a medication, contraindications, compelling indications, obviously guideline-directed therapy is going to be important in the BCPS exam. Major and unique adverse effects. So using sertraline, for example, in somebody that has chronic diarrhea, we'd probably want to choose a different SSRI and an SSRI that doesn't cause as much diarrhea. So just recognizing that adverse effect profile in association with the medication and why that might make it a good choice or make it a bad choice in that unique kind of clinical case scenario that you may be presented. Monitoring parameters, drug interactions, genetic consideration. So if you've got somebody, with elevated LFTs, and you've got a choice of selecting certain drugs for a condition, we would probably want to avoid drugs that are going to be, contraindicated in hepatic impairment, for example. So just recognizing a lot of these things and how they may affect drug selection in a given case scenario, I think that's the best way to go about preparing for this exam. I get asked about dosing. I don't heavily focus on dosing. I don't recommend heavily focusing on dosing. I didn't do it. The exceptions to that would be situations where, anticoagulation, for example, where the dosages are really specific to a given indication. Recognizing what the dose change might be in a patient on warfarin, for example. Recognizing maybe how to manage aminoglycoside dosing based upon some of the pharmacokinetics there. If there's certain antibiotics and certain doses for certain conditions versus not. If there's a boxed warning, regarding a dose in geriatric patient population, for example. Those are unique situations where I think it would be relevant potentially to know the dose. But if you're going to pick a random medication, let's say gabapentin, on the BCPS exam, the likelihood that they ask you, what's the maximum dose of gabapentin, they're not going to do that in general. It's not to say they can't, but I think, the teaching point and being able to, pass and get the credential, I don't think that's an important aspect in becoming a BCPS pharmacist. It's more in the interpretation, drug selection, and knowing what to do given a clinical situation, or knowing what the best option is given the potential options that you're provided in that situation. That's what's going to be important. So don't focus a tremendous amount on dosing, except in situations where there's specific doses maybe for specific conditions, such as anticoagulation, for example, and apixaban. and that type of thing. All right, continuing on with the content outline for the BCPS exam in the spring of 2024, 25% of this exam is what's called application of evidence to practice and education. So naturally, application of evidence, that's evidence-based medicine. So that's interpreting clinical literature such as statistics. So this has definitely been a heavy focus over the years on the BCPS exam. If you know statistics well, and I've seen it, reported on the internet, all that sort of stuff, and I felt that way myself. If you know statistics well, you will likely do well on those questions. And so, we've designed our study materials to cover the most important concepts of statistics. And I think if you prepare and understand the terminology and what it means, it's definitely going to give you a huge boost in trying to pass this exam. If you overlook statistics, if you don't pay attention to it, that is probably the number one recipe for pharmacists failing this exam, in my opinion, at least over the years. And then, of course, we've got other things associated, level of evidence in clinical literature, teaching strategies, things of that nature, whether you're working with patients or providers or whoever the audience may be. So lots of different things that go into that. There's more things listed in the specific content outline. So you may want to look at that, but obviously we've done our work in getting all that stuff into the content outline to make sure that you're well prepared for this 25% of the exam. And then last but not least, in our 2024 spring content outline, healthcare systems and population health. So this is 10% of the exam, so that would be 15 questions, obviously, out of the 150. Historically, many years ago, it was referred to as kind of the regulatory section. And so these are some of the things that have been listed in the content outline over time. Again, we've put a lot of this stuff into our study package to make sure that you're covered for this section as well. Just a quick summary of what our content entails. I just got done in late 2023 here doing a bunch of updates. Over 20 videos were updated just to keep up with current guidelines and new medications and any what I think are clinically relevant changes to given disease states. We had I think 800 or 900 slides in our original package. We're up now to 1,300, so we continuously keep adding content, trying to make it better, obviously based upon customer feedback and all that good stuff. The question bank now is up to over 1,500 questions. In addition, we've got a couple of mock exams. Remember, I said it's really important to, whether you use our study materials or somebody else's, it's really important to time yourself on questions. I can't stress that enough. I've had a few people email me saying that they didn't get through the exam, and you've got to take the time to do that. That's a no-brainer, and definitely you would not be happy with yourself if you didn't pass because you didn't get through all the questions. In our practice questions, practice exams, we've followed the BCPS format where it's basically a multiple choice question with one correct answer. We've designed a specific statistics study guide that's PDF format as well as regulatory study guide. We've reviewed and updated this annually as well, just in case, when we've gotten feedback from folks and that type of thing where, you should have included more on this or whatever the case may be. We've got some comparison tables that we're reviewing as well, getting those updated, and then MP3 files as well. If you're interested in the review course as an MP3, just to kind of listen to it as you're working out or driving or whatever the case may be, we've got that access available. Note that the videos are embedded onto the website, and we use the YouTube player. We figure most people are familiar with that, and that's probably the easiest way to provide those PowerPoint videos. And then you can have the option of 1 year, 6-month access. I would say it's probably split, maybe 50-50, where some folks want to do that 1 year access just so they have either a little extra study time, or they also have that buffer if they don't pass their exam, where they've still got the content for the next testing cycle as well. So, and obviously the 1 year all access pass is discounted significantly versus having to purchase a 6-month access twice. So that's kind of the advantage there. And then we do have question bank only options. I know other folks have used different study materials at times, and they've wanted more questions. So this was relatively new in the last couple of years. We opened up a question bank only option. So if that interests you, certainly you can find that on the website as well. So we've got plenty of testimonials, plenty of customers who have reached out to me. Definitely makes me feel good about our content, obviously, and that I've tried to, continuously stay on top of it and update it on an annual basis. Definitely numerous people who've used our content, and obviously it's been a help to them. But obviously a lot of these folks have put in the time and studied themselves as well. So if you want to pause it and read a few of those, feel free. Otherwise, I'll go on to the next slide here. All right, so let's get into the fall 2024 BCPS content outline, because it has changed significantly, in my opinion anyway. So we've got two areas. We've got patient care specialty areas, and we've got therapeutics and management. So in my opinion, this is kind of basically under the umbrella of the 65% pharmacotherapy, but they've bumped it up now to 72%. So this is that, drug selection. And they actually outline the areas, which is new, and I've got that on the next slide for fall 2024. So those areas are considered primary, secondary, and tertiary. I'm not sure exactly why they separate them out like that, because the percentages are virtually identical. So it's not like, the primary areas are necessarily more important. I guess maybe they are, in a sense that there's less of them listed, and so that percentage is close to the same, but it's not quite as broad of areas, I guess, compared to secondary and tertiary, where more things are listed there. So with that said, as you can imagine, the primary areas: infectious disease, cardiology, your hypertensions, your lipids, your all that kind of stuff, nephrology, pain management, endocrinology. Obviously diabetes is going to be included there. And then we've got secondary areas: critical care, geriatrics, pulmonology, neurology. All of this is contained really within the study package and stuff. But it's interesting now that they actually spell it out a little bit. So this is, again, spelled out for fall 2024 exam. These are not listed out in the spring 2024 exam. So if you want to go to the BPS website and check it out for yourself, certainly feel free to do so there. And then that last section is professional practice. So they've got the three sections. The two equal up to 72%. I would basically classify that as the big, broad pharmacotherapy section. And then the professional practice section: quality of care, evidence-based practice, practice management. So that's going to be, a lot of the regulatory stuff, some of the statistics stuff, and things of that nature. So, again, definitely a significant change in my mind. It's probably slightly less focus on statistics, in kind of reading between the lines and comparing and contrasting the two content outlines, which I took the time to do there, and then specifying those topic areas. That's the big difference, in my opinion, between the spring 2024 exam and now the fall 2024 exam. All right, well, that's going to sum it up. If you have any questions, don't hesitate to email me, mededucation101@gmail.com. I may release another video as we get closer to the fall 2024 BCPS exam, just because I know that's going to change over. I'm doing this video in late 2023 in anticipation that most that are reviewing this are probably thinking about that spring 2024 exam. So with that said, don't hesitate to reach out to me, mededucation101@gmail.com. All of our study materials you can find at meded101.com/store. Thanks so much for listening. I hope this video was helpful for you. If it was, feel free to leave us a thumbs up or a comment below. And like I said, you've got my email there if you have any further questions. If you're looking at our study materials, meded101.com/store.